I've come across an interesting case at work. According to the patient, his toenail plates were removed in childhood, which is why we see this situation today. After discussing with the surgeon, we came to the conclusion that as soon as we regrow a small part of the plate, we will have the opportunity to restore the nail further. Surgical intervention may be required if the patient wishes. Now we will clean everything up. Then the patient should consult a dermatologist for systemic therapy. In this case, it is clear that there is a secondary infection of the nails. There is also a symmetrical infection on the smooth skin of the foot, which can also be seen from the clinical picture. Medication will be prescribed. Now, look at the result after treating the nail plates. Antiseptics were used. There is not much left of the nails themselves. The nail bed is completely destroyed by pus. The remains of blood vessels were treated to prevent bleeding. On the big toes, there are practically no nail plates left. The feet were treated. One nail is completely corroded by purulent masses, only the nail bed remains, there are no nail plates. You see palmar plantar pustulosis, psoriasis. A dermatologist's appointment has been scheduled to confirm or refute the diagnosis. The nails on this foot are almost destroyed. Everything that could be removed has been removed. Next, we treat it with therapy methods. Details. Palmar plantar pustulosis is a rare chronic dermatosis characterized by the formation of sterile pustules on the skin of the palms and soles, with a torpid, recurrent course. The disease affects mainly middle-aged women and is also highly associated with smoking. Thank you for watching this video. If you found the video helpful, please like it. If you didn't like it, dislike it. We are very interested in your opinion about this work. Share it in the comments below the video. Please subscribe to not miss new videos about the work of medical professionals.